nurse manager.
Got it. Thank you. Thank you. All right, everybody. While you're all chatting, hey Donna, go ahead and put in the chat where you're from, what organization you represent, your job, anything and everything that you want to share. This is supposed to be more of an interactive webinar than what I've normally done for Count the Kicks. So feel free to put questions in the chat, questions in the Q&A. You can raise your hand, I can unmute you. There will be an opportunity during a panel discussion where I'll be asking Nancy and Jennifer questions, but feel free to ask questions at that time too. So a little bit of a housekeeping. We do have this slated for an hour. I know you are all very, very busy individuals. This is your lunchtime. This is your personal time. So thank you for taking your time out of your day to talk and have this important conversation. My name is Megan Ockett. I am the program director with Healthy Birthday, which is the nonprofit organization that created Count the Kicks. Just going around really quick, can you just put yes or no if you've heard of Count the Kicks? Just if you've heard of Count the Kicks, yes or no in the chat, so we kind of know what we're working with here for a little bit. So I see some yeses, I see some nos. So the good thing is you're going to get just a brief summary of what Count the Kicks is later on in the conversation. If you want more details, I'll be sending out an email with an online CE training that you can take too, that will kind of go into it. But today's conversation is all around implementation and why we need to be talking about the importance of tracking fetal movement in the third trimester of pregnancy. So I am located in Iowa. Count the Kicks was and is founded and works in Iowa, but we're a national organization. So this is being recorded. After the webinar, you'll get a recording, you'll get a PDF of the slide decks that we're going through and some additional links that we'll talk about too as well. I know that we are talking about a very heavy topic. Stillbirth is a tragedy. We want to make it a tragedy of the past, but we need to be talking about it. So there are some images and terminology that may trigger some people. And I just wanted to put that out there in the universe and know that we understand that this is heavy and that for an afternoon, this could be a lot, but it's also imperative that we talk about this because too many babies are dying from stillbirth and preventable stillbirth. In fact, in Florida, this is based on the most recent 5-year average, the stillbirth rate in Florida is 6.93 deaths per 1,000 live births. So you can see your red line there is significantly higher than the national data and even Iowa's data. So we want to get you to that yellow line where Iowa is, where we've had that 32% reduction in the stillbirth rate because of the inception of Count the Kicks. And so we want to get you past yellow, actually. Wouldn't that be amazing? But we can't do this alone. We have to have the health systems. We have to have providers. We have to have amazing nurses talk about fetal movement monitoring. We lose way too many babies from preventable stillbirth. In Florida, 1,534 babies a year are born still in your state. So we want to decrease that. If we take a look at the race and ethnicity data that we have through the Florida Department of Public Health, you can see there's huge disparities, especially among Black individuals. Black women are, let's see, 2.5 times more likely to experience a stillbirth over white women in your state. So we want to make sure that we're centering women of color, that we're centering equity, we're leaving our biases at the door. On our online CE training that we'll talk about here, and I'll send in the email, we have a whole section on equity and inclusion. And so I want you to keep in mind as we have this conversation, as we hear about ways to integrate Count the Kicks, the stillbirth prevention education, as you hear about stories of loss and stories of baby saves, that you think through, how can I integrate this into my system? What will work for me as a labor and delivery nurse versus what works maybe for an OBGYN clinic that sees people routinely versus triage? There's a lot of ways to integrate this. This should be easy. This is non-invasive and it's very, very low cost. In fact, it's basically free in your state to talk about Count the Kicks, to order the materials, which we're going to talk about here in a little bit. But before we dive in, I have two lovely, wonderful individuals on my panel today, Nancy Travis and Jennifer Mikenas, and I would love for Jen to share a little bit more about why she is here today. So Jen, take it away. The floor is yours.
Thank you so much, Megan. My name is Jennifer Mikenas. I live in the Melbourne area, so that's over on the East Coast. And I am your Count the Kicks ambassador for the state of Florida. And what that means is I am here to support you in any capacity that you see fit. So if you need help ordering print materials, if you need help implementing this within your organization, I'm just here to support you. And then the other half of what I do is direct contact with expectant parents. So sometimes I'll work tables at community baby showers. That image Megan has up there is at the US Poverty Conference last fall. And the reason why Count the Kicks is so important to me is that I found Count the Kicks, unfortunately, too late. You can see my handsome little son, Jonah. Unfortunately, I delivered him stillborn 2.5 years ago, so January of 2021. And I had gone in to see my obstetrician for no fetal movement. They sent me over to labor and delivery, and we learned that he no longer had a heartbeat. I was 30 weeks pregnant. This was after 7 years of infertility. So our miracle baby had died, and we obviously were shocked, induced, delivered him. And we were told sometimes these things just happen, and that his death was unexplained. We declined an autopsy. We just couldn't imagine doing that at the time. But that didn't sit well with us because I had been a very high risk pregnancy because of my age, but also because our son had been screening very high positive for Down syndrome. So because of that, I had been monitored very carefully. I had seen my OB frequently. I had an MFM I absolutely adored, and we had switched over to a new MFM in Orlando, which is where I was going to deliver him. We had been into labor and delivery triage. We felt like we had wonderful care. And so we just couldn't move forward without knowing a biological cause. And so we actually paid out of pocket for a research lab to review slides of our placenta. And we eventually learned that we had a cord loss. So he had clots in his umbilical cord, and there was evidence of repeated compressions of the cord. And while those two things are not biologically preventable, we actually had 2 early warning signs that he was in distress. And that's why I firmly believe that Count the Kicks would have made a difference for us. One of those things that we didn't know at the time was 1 week prior, on an ultrasound, it was detected that one of the arteries of his umbilical cord had stopped functioning. They didn't realize that was a change from our history because we were at a new office, and we didn't learn that information in time because he passed away 5 days later. But the second early warning sign we had was 48 hours before I delivered him. I had a strong surge of kicks. And at the time, we were so excited. I had called my husband in. We were talking to him. We just thought maybe like something that I ate. It lasted about 35 minutes. And now I know that that wild surge of kicks was really a sign of fetal distress. And at no point during my pregnancy was I really educated on how to monitor fetal movement. I was always asked, is baby moving, yes or no? But I didn't really understand that looking for his pattern and knowing his pattern was the most important thing. So I learned what Count the Kicks was doing, and I just don't want to see this happen to any other parents. So I joined on as a volunteer, and I'm hoping to help bring this to Florida. It's already here, so I'm helping to spread awareness of it in Florida. And I think, Megan, you were going to tell them a little bit about what Count the Kicks is, how it works.
Yeah, thank you, Jennifer, for sharing Jonah with us and sharing your story and honoring him this way. He is so loved, so loved. So thank you for that. So as we keep Jonah in the back of our minds and our hearts, and we move forward to talk about implementation of this, I mean, Jennifer said, I was just asked, have you felt baby move, or not continuously, not having that conversation, and that's where we can come in. So for those of you who don't know too much about Count the Kicks, it is an evidence-based stillbirth prevention program. What we do is we educate, and what you'll do is you educate expectant parents on the importance of tracking fetal movement every single time you see them in the 3rd trimester of pregnancy, so 26, 27, 28 weeks and on. What you're doing when you're sharing this information is that you're empowering expectant parents to speak up to providers if there's a concern. So the material is bright, it's colorful, it's inclusive, it's available in multiple languages. I'll talk about the materials in a second, but I want to talk about our Hallmark tool. This is our free kit counting app for parents. So this is what you'll share when you're having these conversations. You'll say, hey, have you heard about this free app? This is how you can track your baby's movements. That way you can notice if there's a surge, if there's a change in your baby's normal movement pattern, you can speak up to your provider with data in your hands. So the way it works, you just download it from your app store. There's no ads. You pick a time every day in the third trimester when baby's most active. So, or whatever time works for you. Maybe it's 2 o'clock in the afternoon during your 15-minute break. Maybe it's in the evening when you can sit down and everybody else is in bed. Whatever time, you need to keep it consistent because that's how you're going to get the pattern, right? So you pick a time, you sit down, you feel that first movement you want to start with, and you tap that footprint. Every time you tap that footprint, the timer goes all the way until you get to 10. And then the app will ask you to rate the strength of those movements. So Jennifer kind of mentioned this, right? She had very strong movements that were different than normal. They were excited because everybody could feel them and see them and things like that. That was different than what she had normally expected. So what the app does is it would ask her to rate the strength of those movements. So we want everything to be kind of the same throughout the couple of weeks that you've been doing this daily. That's why it's so important to do this daily so you can recognize that pattern and trend. And so what happens then is the app gives you a graph, a very visual representation of how baby's been moving. It gives you a line graph for how long it takes baby to move and a bar graph for the strength. So you want things to be pretty linear, right? So that way, if I'm counting, and let's say for the last 2 weeks, I've been counting 10 movements and it takes my baby on average 17 minutes. It ranges from 15 to 20 minutes. That the graph and the app are going to show me that, so I don't have to think about it. But then one day I'm counting and it takes an hour and 15 minutes. What happens to that graph is it will spike up, indicating to me as a user, that's not my baby's normal. I need to go to my provider and see what they want me to do. I either need to go in. If I can't get a hold of somebody, I should go in anyways, but hopefully my provider that I call says, come in, let's get checked out. And Nancy's going to talk a little bit more about the process they do for implementation of Count the Kicks here in a little bit. So this quantifies basically what you're feeling. That gives you data in your hands. We also have paper kit counting charts. So if you work with a population where just apps are not for them, they don't have smart devices, they don't always have Wi-Fi to connect the data, they can use paper kit counting charts. The most important thing is understanding what's normal for their baby and picking up on that pattern so they can notify and say, whoa, my baby does not move like this normally. Like that is not my baby's normal. I need to see what's going on. Because what research shows is that a change in baby's movement is sometimes the only warning sign that's baby's in distress, even before the heart rate changes. So that's why if you do have somebody come in with a change in fetal movement, the protocol is not just to do a Doppler test and hear the heartbeat and send them on their way. You do additional testing, I'm assuming, right? For those of you that are medical providers and nurses and things, you should be doing those additional tests to check on the well-being of the baby. It's just like you and I. When we're sick, we conserve our energy. We don't move as much. We rest. Same with baby in utero. If something's going on, compressions on the cord, low amniotic fluid, something's changing that baby's movement, that's going to be picked up by the parent, the person tracking the movements, and that needs to be seen automatically. So how do you have this conversation with your patients? It's very simple. What questions do you have about your baby's movements? Here's a free brochure. I want you to read this and I want you to download the app. You have free educational print material in Florida, thanks to our partnership with the Department of Health. You can order posters like you see here, brochures, app reminder cards. I would love, and I know Jennifer and Nancy, we would love to see these materials placed in restrooms, waiting rooms, patient rooms, at checkout and check-in. Libraries order this. For those of you that are Healthy Starts and home visitors, order these materials and take them with you throughout the community. They come in English, Spanish, Haitian, Creole, and Portuguese in Florida. We are giving away a $15 gift card for anybody that places an order during this presentation. You can just scan that QR code or go to counttthekicks.org and click on order materials. They have magnets, posters, but this is how you have the conversation. This is how you start it. You say, here's a brochure. I want you to read it. What questions do you have? Download the app and let's talk about it. Nancy, at your location, and I know you're hospital-based, but like for me, when I was pregnant, and Jennifer, I don't know if you did this, I had to take the glucose test, the drink, but I had to sit there in the waiting room for an hour. The nurse had to like watch me do it, take my blood, and then I had to sit there. Did you all have that? Did you have to do it, or did you do it at home and wait?
I definitely did it in an office for
You
sure.
did it in office. So I don't know if that's like protocol or what, but that is the perfect opportunity. If you guys do that in your clinic setting, hand them the brochure after that great sugary liquid and say, read this, download the app, and then when I come back for your next blood draw, we're going to talk about it. Perfect time and opportunity to talk about this. So free app, free materials, you can't go wrong. But how do you implement this? Like, let's talk to Nancy and see how she implemented this in her health system and how you can take that and integrate it into your health system as well. So Nancy, tell us a little bit more about you, introduce yourself. How did you learn about Count the Kicks and go from there?
Excellent. Thank you, Megan. I am at Cape Coral Hospital, which is part of the Lee Health System, and we deliver about 1,500 babies a year. And when I first came to OB here at the Cape Coral Hospital, we had a nurse had done something pretty cool, but on how to count kicks, and had it in a drawer. And sometimes we could find it and sometimes we could not. And so I went to an AWHONN convention many years ago. I can't even remember how far back it was, but it was a long time ago. It wasn't this past one, but although they were there that time too. And I saw this Count the Kicks material and it was already printed up. And I'm like, oh my gosh, this is like amazing. I can't wait to take this back to my hospital because we want to give something to the patients that are coming through OB triage, and we have nothing except for that one piece of paper that we photocopied 100 bajillion times. And so this was a way to get that material. And I think when I first started ordering the material, Florida was not one of those hospitals that had the free material. So I just paid for it out of my pocket because I thought it was very important to have in our triage area. So we bought it. I became active with Count the Kicks because I believe in it. I had a stillborn myself, and I also had a 28-week granddaughter named Kendall that was also born still. So I am passionate about this. It's something that I like to have available. We like to have this stuff out. Brought the stuff back to the nurses. My nurses were like, oh my gosh, this is amazing. We put it up everywhere. We have it on a bulletin board. We have it as you first check into the department. We have it in triage. The really cool thing that when we started working with Florida Department of Health, Florida has a lot of Creole speaking patients. So that was not a language that Count the Kicks had at that point, but they developed the Creole material just for us. Well, it's for everybody, but because Florida has the Creole population, we spurred them on to get the Creole information. So we have it in all the languages. It's available to us. It's free. I was telling Jen and Megan when I went to a provider's office this morning just to walk down and visit, they had the Count the Kicks material out on their area where they see the patients, and I was so happy and gave them some more kudos for having all that material. So it's very, very easy. So then we came back. There's free webinars, there's free contact hour material, there's an online contact hour that you can do training with your staff. So that's available and you can do it anytime you want. You don't have to have it, at work. We do like to tell people about it, that it's there. It's very good. And it's easy. And it's just another story I had during COVID. I was wearing a Count the Kicks t-shirt. And I was standing in line to get my vaccine, and a pregnant lady was in front of me and she said, Count the Kicks, what the heck does that mean? And so I was able to share with that mom right then. I keep the app on my phone as well, just so I'm able to share it with moms. You never know when you're going to run into a pregnant lady that may want to know about it. So it's very easy to show her. I have it on my phone. They can play with it on my phone first if they want to, but it has been helpful to have that. After we had implemented and got the program going at Cape Coral Hospital, this is a picture of baby Deo and his mom. And baby Deo, our baby Deo's mom, came into OB triage one day. She was an adolescent mom at the time, and she had been triaged a couple times before and had been taught about counting the kicks. And she came in because she had not felt him move. And we brought her in, we put her on the monitor, we noticed fetal distress immediately, and she was rushed back to a C-section room and had a C-section, and he came out alive and well. And it was just because she had listened to the teaching that the nurses had given her. She counted the kicks. She did not wait for her mom to get home from wherever her mom was. She just came to the hospital. I don't even know how she got here, but her mom followed behind her. So she got to the hospital and got checked out, and now she has 2 babies, but baby Deo was definitely a miracle, and thanks to the team that got him out quickly.
Yeah. Yeah, I love that Deo's story. And I think that's really important that your nurses talked about it all the time, even though she visited triage multiple times. I don't know what she was visiting for all those times, but every single time you saw her, it was talked about, right? So she might not have even been using the app, but she knew something was different. And that's and the app is a tool, right? You don't have to use it. It's really a great way because then you have data in your hands to show. But yeah.
It can be anyway. And I like that we still have that piece of paper for moms. Some moms just don't want to use an app. But the paper tool is available, and they can use it. And however they're doing it is the best way for them, as long as it's getting done.
Yeah. And as many opportunities, you think about it, I can't remember the quote or the saying about like seeing something 3 to 4 times and before it becomes like ingrained or something, but the fact that you have material out and you're also talking about it and you have it entry it, like that's key. So as many, I want people to see it at the library. I want to see it when they give their urine sample. I want to see it when they get handed after the drink. I want them to see social media ads, which we do in Florida, billboards. If you've seen any of our billboards, the more times the better. Don't think you're ever over educating, I guess, your parents. Like you should always be talking about this. So I really want to have an opportunity to talk to Nancy and Jen a little bit more about this integration and implementation. And feel free to put if you have any specific questions in the chat or Q&A we can ask, but I have a couple of my own that I just wanted to start the conversation. So Nancy, I think one of the top questions I get when I do trainings and outreach with providers and nurses, especially, and I love nurses. So y'all, we just went to the Association of Women's Obstetric Neonatal Nurses Conference. Nancy and I went, it was in New Orleans. And so we meet hundreds of nurses. We probably talked to well over 400. I mean, it's an amazing, labor and delivery nurses are amazing. All nurses are. But Nancy, when you brought this back originally and it wasn't free, like it is now, did you get any pushback from either your own staff or from providers about, oh, we don't need to talk about this? Or what kind of reception did you get?
We really didn't get any pushback because we were already talking to moms about counting kicks during the day. So we really didn't have any pushback from us. But having it available, and they didn't care how it got there, how we got the materials, because I just will pay for things that the hospital sometimes will not pay for. So I'm like, just buy it because it's good. So they didn't ask, there was no complaints about buying it or anything like that. And the docs and the midwives that we work with already were using it. So and then when we had the baby saved, that was like, yeah, and that's why we do it. So that was talked about for a while, and Nurse Donna was amazing and picking that up. And the thing is you have to listen to moms when they come into OB triage and OB-ED. You have to listen to where they are or to the office. You have to be listening to them and getting the cues that are coming from that mom. And no matter what she says, we have to be treating her with respect and dignity, and to be making sure that we are really, my baby's not moving as much as it usually does. I don't know, it's okay. I just drank some ice water because we're in Florida and, everybody wants to have ice water. Yes, we want to keep you hydrated, but drinking ice water to make your baby move is not the go-to. We want to hear what's going on, but really listening to that mom and saying, if she says anything, decreased movement, not kicking, anything, we believe her. And you have to believe her because she knows her body and her baby the best. So she has to, if she gives you any of those cues, you just go right through the whole thing. And that becomes sort of an urgency with the treatment and care that we're going to give to that mom. Right now, Florida Perinatal Quality Collaborative is going through the social determinants of health with many hospitals in Florida that are on this journey with FPQC. It just started. But part of that is respectful maternity care and getting educated on respectful maternity care. AWHONN has a great respectful maternity care program that's out there that's going to can be used as a part of this, but their FPQC is developing something that is also available that's going to be free to hospitals. But just how we're listening, and when we saw the disparities of the Black moms, that just breaks my heart. It's like we just have to, and Jen, of course, your story, we have to make sure we're listening to moms, no matter what they say. It's they're the most important person that day that we're taking care of.
Exactly. We've done surveys too for app users and things, and I think it was something like 87% said, if my healthcare professional, if my doctor, my nurse said, I want to hear from you and I want you to track your baby's movements, they would come in. Like, you make a difference. And I also remember a story where the lady said, all the nurse did is she put her hand on my shoulder and said, I want you to call if you have any problems. And then letting people know, what if it's after hours? I think as humans, especially, I mean, me, when I was pregnant and, a woman and mom, I was like, I don't want to bother. I don't want to bother anybody, right? Like, it's probably nothing. Or significant others saying, don't worry about it. Like, trust that gut instinct, right? I think that's key too. Letting your patient know you want to hear from them. That's your job. That's what you want to do. That's awesome.
Right.
Jen, so your story is very moving and impactful and empowering. What's your dream for Count the Kicks in Florida then? What do you want to see happen?
I would love to see, from like appointment number 1, we are educating our parents, but I want it to be a regular conversation at every appointment. Not is baby moving? And early on, they're not going to be able to feel baby moving, but every pregnancy is different. Some people don't start to have a pattern until week 26 or week 28. Some people have that earlier. I want that conversation about fetal movement to be an open-ended conversation. Well, of course, how long does it take to get 10 kicks? That's important. But also things like, when do you feel baby kicking stronger? When do you feel him or her kicking more often? When are they usually resting? That's the first half of it, is just really empowering parents with how they can monitor baby's health in between appointments, because you're really flying blind. We trust our providers, we love our nurses, but in between appointments, you feel kind of helpless other than picking up the phone. So how your baby moves is really the only way that you can communicate or understand their communication on whether they're feeling well or not. I know for me, one thing that I should have picked up on is, even though I was feeling regular movement up until about 48 hours before, I should have picked up on that strong surge as being different. But the next day when I went into work, there was always a time when I would get this little movement from him. It was when I would sit in my office chair at work every single time. And also when I was in the shower. I think he liked the sound of the shower. And the day that I decided I was going to go in to get checked out, it was because I all of a sudden had an epiphany that the day before I had not felt him move when I sat in my office chair. And that morning I had not felt him move when I was in the shower. And I hadn't been trained on how to count to 10 kicks properly. What I had heard was actually 10 kicks in 2 hours. And we know that that's a myth. We know that's not true. Every baby's different. So while one parent might take 15 minutes to get to 10 kicks, if it then takes 2 hours to get to 10 kicks, baby has slowed down. So something might be wrong. And baby A is different from baby B. So my dream would be that every parent starts to get comfortable with what their baby's pattern is. But the other half of that is that they are comfortable speaking up, exactly what you were speaking to, Megan, because if they don't speak up, then it doesn't matter. And just not feeling bad, not feeling like you're bothering anyone. And then the third part to that is when they go in and actually talk to their nurse or their labor and delivery, that they are listened to. I mean, that would be my dream for every parent in Florida.
Yeah. Because, and Nancy, you could probably answer this as a medical, with your nursing background and medical background, when, and I mentioned it earlier, but when somebody does come in with a change in fetal movement, it's not just a Doppler, like a heartbeat, and send them on their way. Like there should be additional testing done, right? Because
Right.
Mhm.
Usually go through a biophysical profile, which is an ultrasound test to make sure that a baby is doing well. As in addition to the prolonged non-stress test or fetal monitoring, just to see where they're at.
Yeah.
And sometimes it is that you put the baby on, like baby Deo, we put him on the monitor, her mom on the monitor, and that was immediate. We knew we didn't have to do anything else except get him out. But if you're not sure, you stay until you are sure, and you make sure that those other tests are done.
Yeah. Yeah. And I want to go back to the 10 and 2 comment, because that tends to be a question as well, or when we talk about 10 and 2, or 10 and 1, I've heard a lot. You know, I think it's easy to say and easy to remember. That's what I've been told, like, oh, it's easy to say, so I'm just going to say this. There's research on our website. So on our website, we have an evidence page where it talks about all the research, the Norway study that we're based off of, that showed a 30% decrease when people were educated on getting to know what was normal for their baby movement. But the 10 and 2 and what it basically says in this research study, and why this is outdated and why we want to move away from that, is as individuals and humans especially, and in the United States, we're busy, we're paying attention to the time. I know I slated this for 60 minutes, you know, that's what we're going to stick to, and things like that. So when you tell somebody 10 and 2, and if they've been tracking, especially, you know, for the last 2 weeks, and it's been 15 minutes, and all of a sudden they track same time, around the same time, and it's an hour and 15 minutes or an hour and 30 minutes, and they think to themselves, that's okay, because I was told I should get 10 movements in 2 hours. But that wasn't their baby's normal, right? Their baby's normal for the last 2 weeks have been 15 minutes or 20 minutes or whatever. So that's why that 10 and 2 and 10 and 1, we want to go back to what's normal for your baby. Get to know your baby. What are there some misconceptions or myths that you all, Nancy and Jen, that you've heard that you want to dispel, or anybody in the chat, like, feel free to ask questions, but what are some other things that you've heard?
Drink something sugary.
Yeah.
I did it. I drank something sugary and waited.
Yeah.
I mean, if your baby has changed,
Right.
if sugar is needed to get them to move, then something's wrong.
Right. We don't want to have interventions like that to get baby to move. There's also research on that too. So if you're all questioning the research, this is all research based. It's not like we're just pulling this out, but you're right. We don't want to force babies to move if they're not moving like normal. We don't. Any other?
Well, I think that's important to say, because if you get them to move with just having the sugary drink or the cold drink, and then the baby is really having difficulty, then what's going to happen 2 hours from now? Are they going to slow down again? Is that going to be the insult? So you definitely don't want to do that. Now, again, it's hard to say this, Megan, because we are in Florida and we're always pushing moms to drink and to make sure. I mean, even I walked just out to the car because I forgot my cell phone in the car this morning, and I came back in and I'm sweating because it's that hot here. It's like terrible. So we have to, and I got my water as soon as I came back, because you have to do it. So we have to tell moms to make sure they stay hydrated.
Right.
but not to use the hydration as something to make their babies move.
Exactly. Exactly. Any
Can
other?
I,
Yeah.
can I ask a question? We only made it to 30 weeks, so we didn't make it to, to term, but I have heard, I think it's a myth, so maybe Nancy, you could answer this. I've heard that as you get closer to term, baby will move less.
Mm,
Yeah, and that's an old wives' tale. So babies should remember you're going for consistency in your baby's movement. So that's another reason why we want to make sure that you know what your baby's movements are. So babies don't run out of room. They're not moving because they're too tight in there. They should still be giving you the kicks and moving. So that's very important. And a lot of the grandmothers are probably, I'll say great grandmothers because I'm a grandmother. So would say that to their daughters is like, yeah, that's your baby's not going to feel them that much because we're too pregnant.
right.
Whatever that means.
Yeah, that's a good one. My grandma was always like, "You look huge, you're running out of room." And I had like 3 months left. And I'm like, "Thanks, grandma." So you're right. They should be, and they move during labor, right? Like they're like
Yes.
moving
Yes.
out. So
Yeah, they
yeah,
gotta, there's lots of movements that have to be done so the baby can be born. So yes, still
yeah,
moving
there should
right
be
up to
training
that.
there. The other question we get asked a lot is the anterior placenta question. And I have an anterior placenta, so I never feel baby move. I know research on this. I never had one, but I do know what I've read. Nancy, what do you know about that? Or what have you said to people?
Well, you still are going to feel your baby move, which will be normal for you. So
Yeah.
you might not feel your baby move at the front, but you might feel the baby more in the back or to the sides.
Right.
So you're still gonna feel your baby move.
Yeah. Yeah.
Can I add to that? So I had an anterior placenta, but I also had polyhydramnios. Like when I delivered, I had an AFI of 31. There was a lot of fluid in there. I looked like I was ready to deliver. And so for a very long time, I could barely feel any movement. And with counted kicks, we recommend that you start officially counting around 28 weeks because that's where research shows there's a consistent pattern. And if you're high risk, start at 26 weeks. My regular pattern didn't kick in until 28 weeks, but there was a regular pattern for 2 weeks. There was a regular pattern. And that was with all that extra fluid and with the anterior placenta. So it might take a little bit longer, but there are patterns. Like when I mentioned he would always move in the shower. I mean, that was there for a very long time, not at week 28. I knew that at like week 24. So yes, counting for 10 kicks, but just looking for those little nuances that are really unique to your baby. And one other thing I wanted to mention before I forget is don't wait until week 26 or 28 to teach your parents, because what if they don't have an appointment around week 26 or week 28? So that's why we say start talking about it way earlier than when they need it, just in case there's a gap in when you actually see them face to face.
Yeah. Yeah, there's 2 more things I want to mention before we tie it all together for implementation. One, this always sticks out in my head. One of our ambassadors, another lost mom, mentions her story where she was told by her provider she didn't need to count kicks because her baby moved all the time. And I think you'll get that too as nurses and things like that, like as patients, like, oh, like my son, for example, 5 minutes or less, that kid, it was like a jungle gym in there, right? Like, and I get it, like, why would you need to? But I think in those situations, what we want to say, and correct me if I'm wrong, Nancy, but what I would want you to say is a healthy baby is an active baby, but it's still really important to count your baby's movements so you know if your normally active baby has slowed down, because, and it takes the guesswork out of knowing it, right? We're busy individuals. I almost forgot my daughter's cheer camp today. Like I gotta go take her to cheer camp. Thank God I have a calendar, but it takes the guesswork out of knowing if you're normally active baby, 5 minutes or less turned into 20 minutes or 25 minutes, right? Would you agree? Like,
correct.
Even your active babies need to be tracked.
Yes, every baby needs to be monitored.
Yes, high risk, no risk, all
Yeah.
individuals. Yeah.
Yeah.
And the other thing I would mention, it was active. Oh, the importance, and Nancy, you kind of hit on this too. Well, one, the importance of equity and inclusion and leaving your biases at the door, but also communication. I remember a story, not in Florida, in a different state, a fetal infant mortality review board, which they interview lost parents and ask questions and survey them to get data and things like that. And one story that stands out in my head, this woman, she must have been high risk because she was getting like weekly ultrasounds. So I'm not a medical, I don't know what she would have gotten weekly ultrasounds for, but she went in on a Tuesday for her ultrasound appointment. Everything looks good. They said, great, you're good until next week. And in her mind, she thought, I'm good until next week, no matter what. Where we need to make sure that we're clarifying, you're good for what what we're doing this moment in time, where contractions, change in fetal movement, that is an acute condition that needs, so we need to make sure our communication. So what happened to this woman, she went through the rest of the week. She had a baby shower that weekend. She noticed a reduction in fetal movement, didn't think anything of it because she had just had an ultrasound, and went in Tuesday afternoon, still felt fetal movement Tuesday morning, but Tuesday afternoon, baby was gone. So communication is so important. And that just has stuck with me. One of the things that we're working on with AWHONN, which if you don't know, is the Association of Women's Obstetric Neonatal Nurses, AWHONN. They are a national organization, membership organization of labor and delivery nurses from all over the United States, thousands of labor and delivery nurses. One of the things we're doing at Count the Kicks is we're working with national AWHONN to create a pathway, an algorithm of what to do when somebody comes in with a change in fetal movement, because I'm getting questions, I'm getting calls from clinics, what should I do? And I have no medical background. I have a history and public health background, like that's it. So if I'm getting these and I'm hearing these stories, we need to do something. We need to have some sort of guidelines that people can follow that center the patient at every single appointment, that it's patient-centered care. So AWHONN is taking this up, and we are working on, we'll do a pilot in a couple locations and test this algorithm where we center voices of color and things like that. So, oh, Jessica, we got news for you. So yes, we will be there. Jennifer will be there. She will have a table. So, yep. I'm gonna share my screen. Come visit her.
Get materials.
I'm gonna share my screen again. So we can, but feel free to ask your questions in the chat too. This is definitely a conversation, but this is how you integrate it into the system, making sure everybody knows about this. So if you're not on the call, we have the online CE training Nancy talked about. Nancy told me earlier she has like no turnover, which is awesome and amazing in her nursing staff. But if you do, you want to continue to make sure that they know about this, because I can't do webinars all the time. Jennifer can't come to your health system all the time, although I know she would love to, and we'd love that. There's an online CE training for 2.25 CEs you can take for free. I will send that with the coupon code in the email that you'll get after this webinar. So have everybody take it, do refresher trainings, include this in your paperwork. I'll show you an after visit summary here in a minute. Discuss every time you see them, every appointment. And it's more than just, have you felt baby move today? I live in Iowa where this has been integrated and implemented time and time again. We're saturating the market. But when I was 20 weeks pregnant with my first, so this was in 2013, the app hadn't come out yet. All I said at 20 weeks is, have you felt baby move? Yes or no? And that's it. That's the only time I knew, is because they had posters on the wall about counting my baby's movement. And that's how I knew I should be paying attention to my baby's movement. So share this, communicate with them, and share throughout the community. I'm in Iowa. Jennifer's there in Florida, but she's on the one coast, and Nancy's down here somewhere. I'm learning my geography. We need you all throughout the state to be sharing this information. That's how we're going to impact the stillbirth rate there in your great state. Oh, my computer froze just a second. There it goes. This is an after visit summary gold standard paperwork. Mary Greeley is the place in Iowa, and actually Nancy and Amy Dagestad, another AWHONN member, we did a presentation together at National AWHONN 2 years ago, I think, 2 or 3 years ago, where we talked about integration of Count the Kicks into a health system in Florida versus a health system in Iowa, and what that looked. And both have had baby saves, both have integrated this slightly different because of the demographic and the population. But at the end of the day, the implementation is We talk about Count the Kicks. We have the materials out. We listen to our patients. So baby Brody here, he's our latest baby save. He was their second that we know about. We know there's lots of baby save stories out there that we just don't hear about, because who thinks after the fact, like, I should contact that one app I was using or something like that. But if you hear these stories, let us know. We want to shout them from the rooftop, because today you're going to remember Jonah, you're going to remember Brody, and you're going to remember Nala. That's what you're going to take away today, that you heard these three amazing, impactful, empowering, powerful stories. Baby Brody was saved. If you want this paperwork, this triage form, I can send this to you. But this is what Mary Greeley has implemented and several other health systems throughout the United States, where I went to triage 3 different times with my daughter. I didn't know 30 minutes was her regular. I was comparing her to my son, who was like a jungle gym in there. How great would it have been to have this printed out, so I knew this is how I should be paying attention. I should not be comparing her to my son, should not be comparing her to my friend's baby, anything like that. So we have all of these great tools and resources for you through me, Jennifer, our website. I know Nancy would love to talk about it. And today I'm going to leave you with baby Nala and her story. And I think what she says at the end is very, very powerful. So let's watch.
She came back in after she had me put on the monitor and stuff. And she's like, we're just going to take her. And I'm like, what? And she's like, you know, her heart rate is dropping every time you have a contraction. I was already scared, you know, because I was a high-risk pregnancy. Well, I basically learned from the doctor's office, the little yellow sign that was right there. When she started moving, I was very alert with her movements, you know. That was what I lived for, just because I wanted her to, you know, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I mean, I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if? Definitely to pay attention and count the kicks, you know. I feel like it's important just because had I not, you know, knew to do that, Nala wouldn't be here. Don't second guess yourself. Don't feel bad or stupid. Don't worry about insurance or the emergency room bill. Go check on your baby, you know, because your baby might not be here. You just pay attention, you know, seriously. Like, it's your baby's life.
So I like what she says, where she says, don't feel bad or stupid. Don't worry about this. Go check on your baby, especially those who are in rural areas where they might just be, they have 2-hour drive, or they're going to wait for their family care practice to open the next day. They need to go to their nurse birthing center. It's not something to wait on. So with that, we are happy to stay on and answer questions. Thank you to the Florida Department of Public Health for working with us, for partnering with us. I should mention too, Nancy's on our medical advisory board too. So she always gets my questions of medical nature and helps us ensure that we're up to our best practices and standards and things like that. But thank you all for all that you do. And huge thanks to Nancy and Jen for coming on and sharing this with you all, and sharing Jonah with us, Jen, and his beautiful blonde hair. What questions do you all have? And if not, you're free to enjoy the 9 minutes of this hour. Or Jen and Nancy, do you have anything else to say?
We'll both see you at Florida AWHONN if you're going, so please seek us out. And anything, I know Jen, the same for me, if you need us for anything in the state or whatever, we are happy to answer questions or to help you in any way we can. So yeah, please reach out to us if you need us. I'll put my email in the chat.
Yeah, Yeah, I'll add your guys' email to the email that will go
Okay.
out too. So
Perfect.
everybody that registers gets it. And then expect Jen and I probably to reach out to y'all individually too, to say like, how else can we help? Like, what do we do? Because I'm really big on systems change, and this is what we love to do. Yes, take the CEUs, Jessica. That's awesome. I'll send that right away. Yeah, I'm just so thankful to have this conversation. This is a little bit unique of what we normally do. So I think I'm glad you gave us an hour of your time. I'm so thankful for you, Jen and Nancy, for sharing an hour of your time with us. So thank you.
Thank you.
Thank you. And I was going to add, I saw Jessica's comment about taking the training course. All of us ambassadors have taken that. There's just something about reading the research and seeing what they have done in Iowa and reading about what was done in Norway. You will never forget what you read and learn during that training. It's what propels me every single day, because this is actually happening in the state of Iowa. I know that we can do this in Florida. Goodness, reducing stillbirth rates by 30% in the state of Florida would save 500 babies every year. I mean, that's why not? And our nurses are at the front line, and our patients, as a pregnant person, I trusted my nurses. I talk to my nurses more than I ever talk to my OB. I mean, they are just wonderful. So we're so grateful for everything you guys do for our expectant parents.
I see a nurse for my main illnesses. Like, I love nurses. I love nurses so much.
South Carolina. Someone wants to implement this in South Carolina.
We do have this in South Carolina, Melissa. Let me chat you my email just really quick. We do have this in South Carolina, so you can order the materials for free. And so they're not the same language, like they have English and Spanish, but they don't have Portuguese or Haitian Creole. That's specific to Florida, but we'll work on what you need. But yeah, we do have it in South Carolina.
That's the other good thing. If you see something that Count the Kicks doesn't have, share it and what you would like, because often they will be working on something behind the scenes to get out for us. So
yes,
if some other kind of material would work, let us know.
Yes, exactly.
And does any of you, if any of you have a patient portal, you know, some patients read that religiously, like I always did the day after. If you can have information about Count the Kicks and fetal movement in your patient portal, especially around like week 26, week 28, if you have the ability to push a notification to them, that would be awesome.
That would be awesome. And we can help with that verbiage too. So reach out to us. We're here to help you. This is turnkey, non-invasive, free. Yeah, so we're here for you, because you're the reason this change is going to happen. Okay, now y'all get 6 minutes back. Hey, enjoy your hot sunny weather. I'll be thinking of you in my cool Iowa weather, and enjoy. Thank you all for a wonderful presentation today. I hope you all have an amazing day.
Thank you.
Bye.
Thank you so much. Bye-bye.
Bye.